Hello and welcome to Bottom Line. I'm Cindy Keynes. We have a great show for you today. We're going to talk about holistic medical treatments, and what I'd like to do is introduce my guest for today's show. I'm really excited to have her on. She's the owner of the American Acupuncture Center, Dr. Serena Clavena. Dr. Serena, welcome to the show.
Thank you for having me.
Well, Dr. Serena, when we start talking holistic medicine, maybe for people who are watching, some may know, some may not know, what would you define that as if somebody was curious to understand what it meant?
Well, holistic medicine means that it encompasses all of you. So not just like a heart condition or the reason why you're going to see that specific doctor. It's psychological, spiritual, physical self, and that all encompassed to address your health, to promote optimal well-being is the definition.
Okay. Now I know for you, you're mentioning like there's so many different aspects and things that are being offered. So I thought maybe we could just walk through some of those. Some might be more familiar to people than others. One is acupuncture. I think people hear the word acupuncture, some think, oh, needles, which of course it does encompass, but maybe can you help people feel a little more comfortable to understand when they might want to consider acupuncture, and maybe how does it feel, and especially if somebody's a little apprehensive with needles.
Yes. So acupuncture is really great for pain management, especially chronic pain, low-grade chronic pain. Back pain is one of the most popular reasons why people come in. What acupuncture is the insertion of a very thin needle, nothing like you're used to seeing at your MD's office. And so you can hardly see it. It's like the other hold up to the light, looks like a hair, and you insert that, and where you put it is where there's most electric conductivity in a muscle, so you can shock a muscle into relax it. You can bring blood flow to an area, and you're creating a trauma, a very small one, which brings antibodies in to increase healing ability in that area. And they're left there for about 20 minutes, then taken out, and then they're disposed of. Every needle single use and sterile.
Now, you mentioned, back pain, but which a lot of people, including myself, everybody gets challenged with that. Now, is it something where it would take, one session, 2 sessions, 3 sessions, or maybe that might depend on the person's pain or, what the issue is, that it could be, helpful after 1 session, a couple sessions, a few?
So pain specifically, it takes about 3 treatments once a week to see an effect. Of course, every case is different. The longer you've had something, the longer it's going to take to see a difference. Fertility, the average is about 3 months in order to conceive a child, because acupuncture is also famous for fertility, especially with women.
Yeah. Okay. Now, another area I know is something that, people might think is something maybe new, but maybe it hasn't been, is called cupping. And can you describe to people what that is and what would that be used for possibly to help?
Yes, so cupping is the use of plastic or glass cups to create a suction. So plastic, like a suction pump, and glass fire is used. You put that on the skin and it pulls up toxins and lactic acid to the surface of the skin. Now, you ever see those dark marks that on Michael Phelps or McGregor?
Right.
That's the lactic acid coming to the surface. They aren't bruises. And they usually go away in about 2 weeks, and yeah, it gets rid of pain that way. Especially for athletes, it's great because it pulls out all that buildup from lactic acid from working out.
Right. How does that do that? I'm curious, because you mentioned the suction bringing lactic acid. How does putting a plastic or a cup on you and then pulling it, bring it to the surface? It sounds very fascinating.
So it's kind of like a hickey, to be honest. We also use a little bit of warmth with the heat lamp. So it dilates those blood vessels. And by doing that, it pulls it up through the section. Yeah. I don't know how else to explain it. It's kind of just pulling things up.
Yeah, interesting.
Yeah.
Right. And like you say, many times you see it on an athlete when you see it, sometimes on camera and things like that. Because like you said, it does take a little time for it to go away. So what is the role, we have the role of massage. So massage always, many people, some may not, but many people do enjoy a massage. Sometimes there's deep tissue massages, some other type massage. When it comes to try to do from a healing point of view, is there something different taking place for someone who's there due to, some kind of pain or something they're trying to deal with?
For massage difference is massage likes to push in a lot. So they're always pushing in a muscle to relax it. We like to pull out a lot. And we also mess with the electric conductivity of muscles by putting those needles in because we're disrupting that signal. Also, we're releasing hormones when we put it in an acupuncture needle. So serotonin and dopamine are released. So people always talk about that acupuncture after feeling, that lightness. So things like that is different. So we work deeper and they work on surface. Yeah, so different levels. That's why they're great together though.
Yeah, wonderful. And also another area I thought we could talk a little bit is about herbal medicine. Can you talk to that a little bit and what that might be? I mean, many times people say, oh, well, there's certain kind of tea and things like, so I think sometimes at a surface level, some of us have ideas of things, but then maybe we don't really recognize some of the true benefits of some things that might be out there that can help us. That's not, prescription or something from a doctor. And
yeah, so I do traditional Chinese medicine herbalism, which some people aren't usually aware of. So a lot of people know of St. John's wort and things like that. Traditional Chinese medicine, you never just take one herb. So we're combining herbs in what we call formulas. They're about 2,000 years old. And I add and subtract herbs from that formula to meet your needs. And those herbs are based off traditional Chinese medicine diagnosis. So herb pairings can create almost like a low-grade pharmaceutical, and they slowly build in your system. And about 2 weeks, start seeing effects. So they aren't safe all the time, so never just take herbs. Don't buy them on Amazon. But they're effective. They just take longer, and they're tailored specifically to you, unlike a pharmaceutical drug would be. Mm-hmm.
And, I think that's a great point. Maybe it's not a good idea for somebody to go rogue on it and to work with someone like yourself, a professional. You mentioned Chinese medicine and we mentioned, can we talk about maybe a little bit of the history of that? Because there's so many things that have been done, you said thousands of years ago, and they're still very valid today. So, something was happening then that we're bringing, to here in the U.S. And can you speak to that a little bit and why maybe that kind of approach has worked and maybe we've been able to maybe adopt it more lately here in the U.S.?
So acupuncture was actually brought over by Nixon. His, I think it was treasurer, got sick in China, and he was given acupuncture because he had to have surgery, and it was great for his post-operative pain. Oh, he had appendicitis. And yes, and he came back and he was so thrilled with acupuncture, and he brought acupuncture and made it more popular here in America. But acupuncture has been around for thousands of years. When it first started, instead of needles, they used little thin fish bones, and but it works because in that time period there was always war and there was always pain, and it stayed around because they've seen that it worked and it was effective. The military actually adopted it for pain. So they actually have battlefield acupuncture.
Wow. I never knew that. So that's very interesting, and again, then you see how it was working here and how it became more popular and so forth. And even back then, of course, there wasn't a lot of social media. So for it to start, getting more, operationalized here is amazing. When we look at things like, not only was it herbal medicine, but also you do nutritional counseling. And so is it something that when, I think one of the things that, you do at the American Acupuncture Center is, as you say, you're looking at somebody holistically, all of their needs, not just trying to, fix this piece or that piece. And I know nutritional counseling is a key as well. Can you talk a little bit about how that can have a key in someone's life to help improve their health?
Yeah, so let's say somebody comes in with anxiety. Mm-hmm. And I might, very simply, to diagnose them with excess heat. So that would entail traditional Chinese medicine, nutrition-wise, would be avoid coffee, avoid spicy things that are moving, stimulants mostly, and foods that tend to move a lot of digestive things. So a lot of ginger can give people a little burst of energy, high sugar, things like that. or someone trying to lose weight, I could diagnose them with dampness. And what that would just basically mean is like avoid greasy foods, dairy, things like that. I also give people alternatives. So like no smoothies, but try, like bone broth sometimes, something like that, because people do like to drink. Some people like to drink their calories. That's fine. And also I walk through about what's most easily digestible foods and things like that.
Right. You mentioned something, and this is me curious because I've been around people who have drank that, and I want to just understand a little bit bone broth. What is the benefits of bone broth?
It's really great in my medicine for what we call blood deficiency. But it has a lot of vitamins made to build blood, just generally. So like anemia, things like that. That's why people drink it. It's full of nutrients.
Yeah, it's very interesting. I've come across people, I see them, in their blender cup having bone broth, and that's, so anything.
You can get that Trader Joe's. So
exactly. And again, it's something that's out there that's normal. It's, you're not putting in anything fake in you, which is probably not helping your system and helping your body in that. When you find people that you're talking to for nutritional counseling and herbal medicine, do you find at this point they're like, yep, I want to try, or do you find them a little skeptical still, or?
So I'm usually the last resort, unfortunately. People try chiropractic, everything. So usually when they're coming to me, they're pretty desperate, and unfortunately that's the case, but they do follow it, and it does help a lot. And of course, I try to let them know, like, it's not forever. Like, it's just until it gets better. It's a little better that you can start adding foods back in. But yeah, my patients tend to follow the directions very well.
Right. And like you said, well, and if you are one of the last resorts, you're a great resort because you're there and you're helping them, and when they come to you, they're willing to at least listen to what, and maybe try something different that they haven't. So, another one that I saw that you have is called Bustion, if I'm saying that correctly. What is that?
Moxibustion. So that is, I don't know if anyone's heard of mugwort, but I think it's in Harry Potter films. But what it's compressed into a cigar-like form, and we burn it. And it burns at a very high temperature. It also has a great scent. But we put that over acupuncture points or areas of the body to promote healing. So that heat moves blood to the area. Also, it brings antibodies because it's a reaction to the heat. So it increases the healing effect. You can also stimulate parts of the nervous system, or like I can turn a British baby with it by putting heat in certain places. So the nervous system kind of signals the baby to turn around. Yeah.
Oh, now would you combine that with acupuncture, or would they be totally used separate? Or, is there a time when you'd use one versus the other, or?
So commonly I do combine it with acupuncture, but training a breech baby, I do not, unless they want to promote labor. It's too many risks. But we actually can even burn it on an acupuncture needle to go deeper into a muscle.
Ah, that's interesting. And now, does that also come into when there's electrical stimulation as well used for healing on parts of the body as well? Or is that, and again, is it combination used with other approaches?
Not usually, mostly because electric stimulation has plastic wire coverings and there's a risk of burning. So we don't tend to do that, especially not in the same part of the body. But electric stimulation is mostly used for muscle pain and chronic pain that's hard to treat because we're going deep in that muscle, and we are actually messing electric conductivity by sending in a new signal. And those needles are placed where there is the most electric conductivity in the muscles. So it's very strong. Moxibustion is very soothing. So it's kind of the other end of the spectrum. So Yeah, they're rarely used together, but they could be. I just personally have not used them together.
Right. Now, when you do electric stimulation or acupuncture, somebody comes in, with, let's say, back pain. How do you know where maybe the needles go? Because, like, for instance, some people might say, okay, I have lower back pain. Some may say, well, it's all over. But again, I may tell you it's in a certain spot, but do you treat a certain spot, or is it more, again, holistic in the whole back, that there might be, even though you feel it in one spot, it really could be another area of the back that's creating some of the issue?
So I asked them a series of questions to figure out where the pain's coming from, even just generally, because I don't believe I'm going to pinpoint that muscle, especially the first time. But when I do address all muscles around the area. So if your low back's hurting, I'm also going to treat the other side. So if your left side's hurting, I'm going to treat the right side, because that other side's probably overcompensating because of the pain. So I will hit the same sides, but of course I'm going to focus on where you're coming in. I'm also going to take your pain into account in the environment that you live in. So what's your job like? Are you sitting a certain way? Like, how do you sleep? What are you eating? Things like that, in order to help you heal faster.
And again, treating holistically. And I think these days, many people, because being on the computer, whether you're working from home or you're going in the office, I think people are sitting a lot or hunched over, especially, with laptops and so on. So and with acupuncture, will you, especially like if someone's getting headaches, that's one thing I'm thinking, is it something with the neck and the head? And because I know sometimes there's actually needles that will go into certain parts of someone's head, which I know would make some people may think, ooh, that's kind of strange, or maybe that hurts. But again, I think maybe them working with you or talking to you might help them understand how it could help them.
Yeah, so there are a lot of different types of headaches. Migraines, actually, it's rarely that we would put a needle in the head, because we're trying to bring all that energy down. For a tension headache, there may be some, yes, to release some tension. For anything with like the cervical area, we will treat you based on most likely to get the muscles in the back of your neck. So it depends on your headache and what we're trying to achieve. So.
Right. Yeah. And again, the best thing is someone's dealing with some issues, come see you, because, is there, and I don't, this may seem like an open-ended question, but is there anything that isn't appropriate to try to give, holistic medicine a shot for, that somebody might have that says, you know what, this just isn't the right thing to do? But there's so many things that the holistic medicine could help with.
Vision. Acupuncture cannot help with your vision. I've gotten a few phone calls, just let everybody know it cannot help, unfortunately. I wish I could. Everything else, I haven't run across anything that I couldn't help in a holistic manner.
Right. Can you talk a little bit about your background, because you have some unique, degrees and experience in that others even in the state don't, and which is kind of exciting. Could you talk a little bit about your background and your education and some of the certifications and some of the things that you've been trained in? And when I see it on your website, over 4,000 hours, I think, oh my goodness, 4,000 hours of experience. It just seems so huge, and which is extremely helpful. I think that people feel a little bit more confident, say, yep, look, that's a lot of time and experience working in your field.
Yes. So start with, my undergrad's in health science, Canada, but I went to Chicago, Pacific College of Health Sciences. I think it's called now. The name changed after I graduated, and where I got my doctorate of acupuncture and Chinese medicine. I was like the 5th graduating class with my doctorate. There were, for some background, there were about 30 people that entered this program, and only 6 of us graduated. They read us out. It was a lot of memorizing. But yeah, so we were always in the clinic, and we worked with teachers that were from China. And at first we would do acupuncture on each other, so different students, which was not nerve-wracking at all. And then we would go into the clinic after we've had 3 years of experience knowing each other. And then we did about 1.5 years kind of like a residency. And then we had boards and certifications like that, and state boards and CEUs, continuing education units. So fully licensed, board certified.
Yeah.
Yeah.
And what made you wanted to start your own practice? That, you started the American Acupuncture Center and build your practice in doing that.
Yes. So I was working, well, I graduated around when the pandemic happened. And I passed boards then. So there weren't like a bunch of jobs, everybody was social distancing. So I got a few jobs. I worked all the way in Milan, Michigan. Then I worked in Rochester and I worked in Bloomfield Hills. So I was driving a lot. And I was really tired of it. And I had to bring out my equipment, and I just didn't think I was providing my patients with the best experience. So I opened up my own spot. I loved my Bloomfield Hills location, and Cross Law came up for a release, and I was like, I want it. And that's why I'm here. And
yeah.
I absolutely love it.
And what advice would you give someone who's maybe thinking of following a path similar to you, and maybe they're apprehensive or something? Would there be some words of wisdom that you'd give them to say, if this is something you want to pursue, like you're doing or have done successfully, that they can as well?
Yeah, so make sure you have a good social media standing, because younger people will look at that and name recognition. They may not book with you right away, but when someone mentions, oh, acupuncture, they'll think of you or whatever your career or business will be. Second is have Google reviews. Those are extremely helpful. You can just ask people, and they're more than willing to if they've had a good experience. And just be nice to people. If someone comes in rude, it most likely has nothing to do with you. They might just be having a rough day. So just try to help them as best as you can, because, well, one, you should, and two, people won't come back if they've had a bad experience.
And I think that's an amazing approach, which I think most people will appreciate. And, you even had that on some of the reviews on your website is, when people come in, they're, like you said, you're the last resort. They might even be apprehensive. Okay, I'm going to give this a shot, but let's see what she can do to me. If she can, and then they know, hey, this person really cares. Dr. Serena cares. And if most people, when they're in pain, they're not in a good mood. I mean, we all know that. Or if you're sick, I mean, everybody understands that. And I think just your approach and understanding, and one person wrote, being just making room for them that day, because some days people are in such pain that anything can maybe help them. And I think that approach is so very helpful with them. And if there's people who are apprehensive to want to do acupuncture or come see you for whatever reason, are there any kind of myths that are out there that people might be thinking that, you'd love the chance to say, what, most people think it's this and it's not, that you can help ease their fears?
Yes, there are quite a few myths out there. One, it's not witchcraft. There is science behind it. So we do things for a reason. Yes, we do have channels and things like that and points, and we do use those things, but they work. And also, every needle is sterile. We do not reuse needles. We can't even clean our needles. They would shatter. Okay? And it doesn't hurt. Most of my patients fall asleep on the table. Yeah, top 3.
That's okay. and that's great. We can fall asleep on the table. What else could you ask for? To just, ease their fear. And falling asleep on the table also probably means not only are they relaxing, but their muscles are relaxing and the body's relaxing, and they're having that positive experience. What happens if do you come across anyone who comes in and says, okay, I want to be fixed one time, and you have to kind of maybe adjust their expectations as well?
So I usually try to do that when they book. I always say, I don't know any treatment that works once. Acupuncture builds in your system. And so it's rare. It's happened maybe once to me that someone expected it to be gone, but I think nowadays people realize that there is no magic pill, magic cure. If there was, I'd be super busy. So, yeah. Yeah.
And you probably would be on an island retired already as well if you're so busy and doing.
Yeah.
And what if somebody's watching and they say, okay, there's traditional medicine that maybe there's things like you said, people might go to the doctor if they have a heart issue and so on. Can this be combined with traditional medicine? It's, doesn't have to be one or the other, so to speak.
Yes, so I often work with neurologists and fertility doctors. We do combine a lot. It's a great complement because we're addressing holistically and they're addressing that actual cause. So we can help what it might cause the pain or fertility, that was diet, things like that. Well, they can hit it harder with their medication and all of their techniques. So we're different, but we do complement each other very well.
So it's kind of best of both worlds. It doesn't have to be one or the other, and it can be a combination where both can help a person and improve their health. But
that's the goal.
As we kind of wind down here on the show, is there any kind of last words of wisdom you'd want to share with people who are watching?
If you feel out of balance or if something's just, you have a symptom or something weird that you can't explain going on with your body, traditional Chinese medicine might be the answer because we believe everything people usually say because everyone's body's different. So if you're struggling with something, feel free to call.
Yep. It sounds wonderful. And I know when somebody walks in, they probably could just say, well, I'm feeling this, this, and this. And when people are explaining to you what they have, sometimes it's always hard for people to kind of pinpoint, well, this kind of hurts, that kind of. So, but you're probably able to just listen to whatever they're saying and figure out, what, I think this might help and that might help the person.
Yeah. So actually there's certain, we have our own diagnostics tools that we use, but if someone comes in and says like, oh, I just feel heavy, that to me is dampness. Or if I feel like something's crawling out my chest, like an anxiety or an outburst, that something's like you have heat rising. There's really anything you would tell us we can put in a category. So it's rare that we won't be able to help somebody. Yeah.
Well, Dr. Serena, thank you so much for your time today and sharing your expertise. Thank you for helping people with their health and getting them healthier and up and running and feeling better. So again, thank you for your time today. We greatly appreciate that.
Thank you for having me.
Yeah. And I thank everyone for watching. I'm Cindy Keynes, and I wish everyone the best of health. Have a great day.